And I've got one in case we run out of time and need it. I've got one, but it's quite short to read. But
okay.
Yeah.
Good. Well, we're going to just kind of wing it, I guess, tonight. I don't know who's doing the interviewing or the introduction or. Oh, there she is.
Hi, Jackie.
Hello there.
My little computer was just having a little bit of a hissy fit, I think. So I had to reboot and restart, and it wasn't going to let me do audio and all that sort of thing. So
okay. Oh, well, you're here. And
apologies galore.
oh, no, none needed. And you're back from your holiday. It sounded and looked beautiful.
It wasn't a holiday, but yes.
Well, you know.
From the routine, that's always a holiday.
Anybody that can make my bed and do dinner for me, I'm pretty darn happy. I'm very simplistic like that, so
yeah,
it's pretty good. So how was your holiday? It looked really lovely, Deb.
Oh, it was awesome. I was just saying to Lee, my suitcase is still packed over here, and my jacket and my scarf are still hanging on my oven door. I didn't get very far when I got home. I just had a bunch of stuff to do, and the unpacking is the least favorite job anyway.
I will get you going.
All right. Welcome, everyone. I am really happy to be back myself because I have been away for 2 weeks, so I missed last week's call myself. But these ladies and our guys did a beautiful job and managed to even get it recorded and uploaded. So kudos, Jackie. I got it back over onto, I added it to the YouTube channel, to our group one too. So it is there finally. Tonight, we're really excited to have some testimonies, some live and some written. And I'd like to just invite Lee and Jackie to just jump in at any time. Don't have our guys with us tonight, our doctors, and sometimes they chime in or they may come in later. But maybe, since Jackie, you've been speaking to Joan, maybe you'd like to introduce Joan as our first live testimony.
Thanks, Debbie, and thanks everybody for coming on board. And I want to actually still extend a gratitude to Lee Rafferty for stepping into to Fawn's shoes, because it's been very welcomed. We've missed Fawn, and it's always difficult to put somebody else into someone else's shoes, but you are doing a wonderful job. So thank you so much for doing that for us.
Mm-hmm.
Thank you, Jackie.
Yeah, and Joan, I want to thank you so much, because I put out an SOS to see who was willing to share their testimonials, and you put your hand up. So I am so very grateful, as everybody else is in IGALN, because this is how we learn. This is how we actually gather information from other people's experiences. So, you know, what you're going to be sharing with us is your experience. So it's in your personal thought patterns as to how you've actually found the products. So I just want to put forth that all the testimonials that we do listen to, there are the contraindications attached to that, and I'm sorry for taking it this way, but we need to understand that this is your personal thought patterns. So everything that comes forth is how you've experienced it. So it's not something that's attached to Dr. Ahrens or attached to Dr. Stefano. So just so we put that there in place. But thank you very, very much. I'm going to pretty much give you an open floor to actually start off and just let us know when you started taking the products. If you can let us know what your conditions were. It's up to you as to how much that you want to share and how much that you'd like to retain to yourself. So that's personal. That's your personal choice, but I'll open it up and you can let us know what your conditions are and what you've experienced, and then we'll pop in and ask you some questions as we go.
Okay, that sounds great. Thanks for the introduction. I'm glad I would have done this much earlier, but I didn't have a camera that worked properly until recently. So I'm happy to share my story because I consider myself a walking miracle, and it's thanks to Emulin and Klamax. But Emulin was the first product that I tried. I realized in getting ready for this tonight, I first was diagnosed with rheumatoid arthritis in 1973. That's how long I had been fighting this. And I went for about 10 years with special pens, special things for my hands, special shoes, trying to keep walking, keep moving. And after about 10 years, they found medication that helped me. And I went on the medication. I've been on it ever since, up until 2016. By that time, my arthritis was quite bad, but I was taking Vioxx, which was really helping. And then I had a stroke, a major stroke. Found out I'd already had 2 small strokes, didn't even know I'd had. And I was left, well, then I had to go off the arthritic medicine because that's what brought on the stroke. And so they said, you can't take that anymore. You can't take any of your medications. Well, what they told me basically was, as I lost my mobility, I couldn't walk without the walker. And then my hands wouldn't function, so I couldn't walk with the walker. So then my only option was a wheelchair. Well, I have stairs all over my house. I couldn't use a wheelchair. My life, basically, I was feeling it was over. I actually saw a specialist that I waited 9 months to see, and I went in and he told me I was a rutted road and that there was nothing anyone could do to help me. And I went home and cried. And then I got angry and I thought, I'm going to find something. I'm going to do something, but I didn't know what to do. And I was sitting in the playroom at the daycare, and I was sitting in the chair with the walker in front of me, and I was crying because I couldn't get up and I couldn't get hold of it. I couldn't walk. And I thought, what am I going to do with my life? And Kathy phoned me and she said, Joan, I've been thinking about you. I want to tell you about something I just heard about that I've just got involved in. And she started to tell me about Emulin. Now, I was very leery of any drugs because of what had just happened to me. And I said, no. And she said, no, it's not a drug. It's a natural product. She said, it won't hurt you, it can't conflict with anything, and it fights inflammation. Well, as soon as I heard that, I thought, I got nothing to lose. I will try it. And so I got my first bottle. I started taking it. Within a few days, my hands had improved enough that I could grasp the walker. And I started to, walk again. Within weeks, I was off the walker, I was onto the cane. And shortly after that, I threw away the cane. Well, I didn't throw it away, it's still upstairs in my bedroom, but I don't use a cane. In fact, I have never felt better in my life. I don't think I have felt this good without drugs since 1972. And that, to me, is stunning because I'm 69 years old now. I'm going to be 70 in September. And I feel young. Now, what happened, I started taking the Emulin. It helped immensely. I just can't say enough about what it did for me. I have fully regained my life. And then Klamax came along, and I started taking Klamax, and that was just adding to it. It just got better and better every day. And then recently I ran out of Klamax, and then I heard Dr. Joe say, 2 pills a day are for healthy people to help them. If you have a problem, you should take more. So I thought, So I upped my Emulin to 4 a day. And the change has been phenomenal. I was out digging a trench. I'm digging a trench in my backyard for gravel to go in because we have a drainage problem. And I was digging the trench, me. That amazes me. I couldn't even pick up a shovel before. I couldn't hold that kind of weight in my hands. I would have dropped it. So for me to be able to pick it up and dig in the dirt is just quite an amazing thing. Yeah. My eyesight's improved, although I still need my glasses for anything close up. I can take them off outside. My distance vision is back. It's the first time since I was, my goodness, in my 20s. It's just been an amazing journey. I'm so grateful to Dr. Ahrens and to Emulin and also to Dr. Stefano and Klamax. I can't wait to get back on it. I'm just waiting for my order to come. But I think with 4 Emulin and Klamax, who knows, I might be a teenager next. It's amazing. My hands, I haven't been able to use my hands properly for years. For so many years, I can't even remember. I had horrible little things that would hold my hands so that my fingers wouldn't, because my fingers were all twisting and bending and turning and big knobs on them. The knobs have gone away. Like my fingers have gone down. They've even straightened out a great deal. And the other day I dropped something on the floor, this little tiny pill, and I went to pick it up, and I did. I picked it up and I put it on the table, and I thought, wow, I haven't picked up anything off the floor. I haven't been able to grasp anything small for more years than I can recall. And I just picked it up and put it on the table. Now, that might not be a big thing to you, but it was huge to me. It was totally huge. And then I went to see my doctor, who's kind of skeptical. She said, oh, everybody recovers from a stroke. You know, there's always some recovery. And I said, but I don't think you get better. I don't think it's normal to get better, just not to get improved from where you were long before the stroke. This is not just normal recovery. This is something extra special. And I'm just so grateful.
So, Joan, can I ask you, like, since you've had, I've got tears listening to you because I get really emotional about people that have had such really challenging journeys, and you've had years of this. And I must say that when I look at you, your face is just a beacon of hope. Like, you have so much love and there's so much gratitude. There's all of these things that are just coming out of your smile. And you can tell that from when you're speaking about this, like there's passion behind what sort of an impact that it's had on you in your life.
Yes.
And firstly, thank you for sharing that with us, with what you just had. But I wanted to ask you, you know, from a stroke, a lot of us understand, or we may have had exposure to somebody that has had that. And it's exactly that. There are always symptoms that people are left with from after having the stroke. And you can visually a lot of the time see that. But are you telling us that from what your personal experience is, that what are these symptoms that you're left with? Are you left with anything at all? Like, do you feel like that you've gone back to, how are you feeling that you've recovered?
Just feel lately a little bit with my short-term memory. Other than that, I mean, I've recovered far beyond what anybody thought I could recover. I went to the doctor recently. I started to say this, and I had a bone density test because I've also had osteoporosis for years, and my bones have been getting thinner and thinner, and it was a great concern. But this time when I went, I actually went up 0.5%. 0.5%. It improved. It didn't go down for the first time in 20 years.
Wow.
And I mean, that's
remarkable.
I mean, my skin has improved. My skin's soft. I mean, my skin felt like a leather factory. And now it's all soft. And I'm moving. I'm doing a seniors fitness program. Oh,
you go, girl.
Yeah. I'm actually having a lot of fun.
And it shows in your face, Joan. You know, like for me, from seeing you being on the calls, being on Jana's calls and seeing you over the period in time from when I first have met you and watching, you always notice people's personas, auras, things like that. What I've really noticed with you is that you've literally, it's like you've been reborn, because you can see that you are a happier person, but your skin coloring, your skin tone, everything within it, you had a real redness in your skin tone before. And that was very prominent. That's disappeared, unless you've got makeup on today or minimum.
No, I thought the call was an hour from now, so I have nothing on.
You know, I look at your skin, and I just think that for me is a huge indicator. The skin's the largest organ in our body, and I'm looking at your skin on your face, and it's just perfect. Like the coloring of your skin, there's no redness there at all from what I can see.
Yes, no, it seems to be gone. I also had rosacea, so I would get red, very red at times, and that seems to have disappeared. I'm not sure if it's totally gone, but I haven't had it for quite a while. And it just, my whole body, like every part of my body feels better. I don't know how else to explain it. It just, I mean, I'm quite amazed. And people who knew me then and see me now are quite stunned. And I tell them all, it's Emulin and Klamax.
So can I just ask you just to repeat your doses from what you do take, so that people
now understand? I'm taking 4 Klamax a day, or 4 Emulin a day, sorry. I'm not taking Klamax because I ran out of it and I'm waiting for the new shipment. But I was taking 2 of those, one in the morning, one in the evening.
That's one of the big scoops in Klamax?
Yeah, actually, I did a half in the morning and a half in the evening.
Okay.
Yeah, although I might go to a big scoop in the morning and a big scoop in the evening. I'm so amazed with what's happened with for Emulin that I'm willing to try extra Klamax too, because, I mean, it's just, I consider myself a walking miracle. I really do. I don't know how else to say it, because it's just been such an amazing journey from, I want to go back to the therapist. I had a team of people in the hospital who were trying to help me learn to walk again and to talk again and do all those, because it was my left side that was affected. So my left side didn't work. So mainly they were trying to teach me how to walk without falling and to talk. And they said the best thing for my talking was to talk a lot and smile and laugh. And I said, well, I do lots of that, so I should be good there. But the rest of me, I was very, very worried about. And then it got really, really scary after I came home, and the arthritis started really coming back because I wasn't taking the medication. And now I don't take any medication. I mean, that in itself is such a relief.
So you're saying all that you're taking now is Igalin products? You're not taking...
Oh, I do take my blood pressure pill still and my stomach pill, because my stomach, I was very badly damaged by the medication I took for years, and they had me on an antidepressant because I was so depressed about it was happening. I was taking Vioxx and Celebrex. I was taking... They wanted me to take 6 Tylenol 3s a day for the rest of my life.
Oh, God.
I wouldn't do it. Yeah, I wouldn't. I said no, but I was taking a lot of regular Tylenol because I was in such pain.
Hence the stomach problems.
Yes.
No, I was a pharmacist for 21 years, and thank heavens I'm not on that side of the street anymore. But, you know, all of those drugs that you mentioned they have so many negative side effects. And to get off all of those is absolutely miraculous, because the rheumatoid arthritis medications are some of the most damaging. They're some of the strongest. Yeah, they're nasty. They're really nasty.
Yes, very nasty.
To get off of those is just such a blessing. If I could just add one more thing, a thing popped into my mind. When you said you were still having a little bit of a memory loss, the neurological cells take longer than any other cells to repair and rejuvenate.
Okay.
So that's just going to be a little longer on your, further down on your list, but I have no doubt that that's going to come back.
Yes, I don't have any doubt either. I mean, it's just been...
Well, you have a laundry list of things already. Why wouldn't we add, improved memory? It's just, yes. I am blown away by your story. So I just wanted to interject that.
Thank you. I was so happy to meet Dr. Ahrens in Las Vegas and have a chance to tell him how grateful I am to him, because, I mean, Emulin was just such a godsend. I thank to Kathy for introducing me. I mean, I would have walked over glass to find something to help me. And I didn't think it existed. I mean, everyone was telling me there was nothing that could help me. And then I started taking 2 a day Emulin, and everything changed.
Joan, can I ask you, and you don't have to delve into this area either.
No, that's fine.
I'm intrigued to find out, because I think this is such a really important part, that when people do have a challenging problem with chronic illness, it affects their lives in so many ways. And one of those areas that it does affect you is that you become isolated. You don't get to involve yourself in family outings. You don't get to do things with friends as much because you just physically can't, or emotionally, mentally, you're just not in that place. How has that changed for you?
Well, yes, I can do things. I went recently to Botanical Beach, which has been a lifetime goal. It's down at the end of the island that I've always wanted to go to, but you had to go down this big cliff, and I didn't think I'd ever be able to do it, and I did it.
Oh, I'm so excited.
Yeah, it was so exciting to do. I just said to Diane, I just That's my bucket list. I just did it.
Oh, so
So
what's on the next bucket list for you?
I want to travel. I decided I want to travel now that I can move again. So it's going to be a little while because I have to financially recover from all of this, but I'm hoping Emulin will help with that too.
Yeah.
But yeah, I want to travel. I want to spend time with my family, and yeah, I'd like to retire. I work with children, and I thought I was going to have to retire. I mean, I was pretty well forced into retirement, but my daughter and I worked together, and my daughter started doing all the work, and I was just a set of eyes. That's really all I was. But now I'm an active participant again. And yeah, I want to retire in about 3 years, and I found the word's gone out of my head. Darn, in Italy, a castle, not a castle, a plaza. Anyway, a wonderful dream place in Tuscany that I want to take my daughter to, and we're going to spend 2 weeks there. I've decided. So
Good on you. Like you really are a walking miracle. You know, to have, you know, to where you're at and there is no hope, and having that feeling of no hope is the most awful feeling to have stripped from you, because there's that one little word that a lot of us don't manage, and that's lack of control. And the control means a whole lot of things to a lot of people, but when it comes down to your health and the fact that you don't have control over your health and the ill effects that it has, that ripple effect that it goes through into family, into friends, it then mentally, it just creates a lot of problems for you. And to see you from where you were 12 months ago and now looking at you now, you really are a Wonder Woman. And it's just...
Thank you. I feel like a Wonder Woman. I do. It's just been amazing. I also credit my Toastmaster friends. I've been a Toastmaster for many years. And I used to go, and I couldn't shake hands anymore, but I'd bump elbows with them. And then when I lost my speech, you know, that's very hard to be a Toastmaster if you can't speak. But I went anyway, and they were very patient with me, and they have been a great support group, as well as the people with Emulin and Galen, you know, people on this team. It's been a wonderful experience. I mean, it wasn't a wonderful experience all the years of suffering, but it's quite wonderful now.
And look at the story that you've got. So I just want to actually ask, has anybody got any questions that they'd like to ask Joan while we've got her here? No, because you've been so thorough with everything that you've told us, because it's quite groundbreaking with what you have. And the beauty of this being, Joan, and I really do want to thank you again before we move on, unless you've got anything else that you'd like to add.
No, it was mainly I want to tell you about the bone density, because I'm very, very excited about that. That was a plus I didn't see coming. Even my doctor was like, you went up.
Yeah. I just really am so very, very thankful that this has been brought into your life, and it's just a remarkable story to hear it. It's even more emotionally something that makes me really so heartwarmingly happy for you, because just to see you, you can see when you're talking about it that the joy that it comes from within you is very evident. You've been given your life back. I would be, you know, presumptuous to say that for me, it sounds like you've had your life completely turned around and given back to you.
Yes. No, that's true. It just when I was sort of thinking it was over, it just blossomed again, and it's just quite amazing. And so I'm enjoying it. I'm going to take advantage of this time.
Yeah. So thank you so much for sharing this with us.
You're very welcome.
And I know that we've got a really nice little man that's been doing some breakups through these calls for us. So Brett Gurney's I'm going to put a plug out there for him at the moment, because he's been very wonderful for us in breaking up these calls and putting them into individual pieces. So we'll ask him to do the same for you. So you'll have that, and as all of us will do, thankfully to you for allowing us to share this, that we can pass it on, because it's just such a powerful testimony for what you've told us.
Oh, you're very welcome. I want to pass it on. I want the whole world to know about this.
Yeah, no, thank you. So what I'd like to do is to move on to Lee Rafferty, because I know Lee has a written testimony. It's only a short one. And please, everybody, if you do have testimonials that you know, because not everybody's comfortable coming on to where they're talking about it in front of people, but they're quite happy for somebody else that knows them to be able to read it out on their behalf. We're happy for those because it's still a testimonial, especially when it's coming from somebody that knows them very well. So if I can hand that over to you, Lee, that would be really fabulous.
Okay, thank you. Well, this is Marilyn, who her testimonial that she gave to me was that after undergoing back surgery over 4 years ago, I was still suffering with bad pain. Pain-killing drugs prescribed to me for life didn't sit well with me at all, but in desperation, I took them. More recently, I developed excruciating pain behind my left knee and down my leg, which became unbearable. I was doped to the hilt on drugs, which was blurring my mind and thinning my hair and not seeming to help at all. I was fortunate to hear about this natural remedy from Galen called Emulin plus E. Although reluctant, I decided to scrap all my medication and give it a try. From the very first day, my pain was no worse, if not a little better. Now, after 1 month on the product and some gentle physio exercises, I can honestly say I'm virtually pain-free, and I can't believe the difference in how I feel. I'm more alert, I have more energy, and I totally recommend this product for anyone in pain and say, what do you have to lose? So, and when I see Marilyn, I always get huge hugs, and it's such a delight to see how well she's doing. So that's Marilyn's story.
Which is pretty interesting because when you listen to Dr. Ahrens, like he will tell you that with the percentage of the gallic acid in there, which is quite high, it's specifically for targeting pain and neuropathic pain. So this is a prime example of what the power of what Emulin can do and what it is doing for people. And it's just really remarkable, especially for back pain. And when you're looking at referred pain like that, it's not an easy thing to be able to manage. No. So thank you for sharing that with us. Yeah, I don't think Ben's going to venture on, Debbie. So did you want to read his?
Yes, I was just texting him again, but he did have the information earlier, but I could read his, or we could wait to have him tell his story on the next one. If there's any other ones to be read, I think I'll give him that option, and then I'll work with him a little bit on Zoom so that we can make sure he can get on and do it. So if you have other written ones, go ahead.
I've got my own, which I was quite happy to do as an update. And mine was just an update. And basically, a lot of you have read this. It's a journal, and my story has been a journal. I'm 52, and it's been from the time that I was born that I have been operated on, probed, prodded, lived in hospitals, been on a multitude of medications. Even speaking to Dr. Arjun on the weekend, he was talking to a couple of people, and it was just another nice reminder just how fortunate that I am, because I had 4 drawers of medication sitting beside me. And like Joan, I was heading for a wheelchair, and I had no hope. There was no answer for me. So Emulin did phenomenal things for me, but what my testimonial here today is an ongoing testimonial for Emulin and Klamax. I was born with a congenital disease. This is just one of 8 diseases that I have. But what I do have is called Marion's disease of the bladder. So I was born with a perforated bladder and a bladder that just would not work. So I basically just could not urinate at all. So at 2 hours old, I had my first operation, and I stayed in hospital for the next 2 years, having surgery constantly for that condition. That's been a lifetime problem for me. Going through school was horrific because I was constantly wetting my pants. I was constantly in and out of hospital. I ended up having 2 children, which both of those, the first one was he was a month preemie, but he ended up being cesarean, and they pierced the bladder. The bowel, the bladder, and the uterus were all fused together, and that created more problems because there are already a lot of adhesions in there. So having another lot of adhesions from having a cesarean and then a piercing of the bladder And then having to separate the bowel and the bladder and the uterus was quite traumatic. I was lucky enough to have another child by cesarean, and they just went higher, which eliminated that. But the story continued. So I think about 2 years after that, I constantly was getting bladder infections, and they found a fistula in the urethra. So the urethra is the tube that comes out of your out of the bladder itself, and it's where it's coming down into, and it's where we urinate out of. So I had a hole in that. So basically, instead of urinating out of where we normally would do, I had half urine coming down through the normal channel. The other part of the urine was going vaginally into my system, so hence where the infections were coming from. I was a very sick person. They fixed that for me, and I started self-catheterizing from the age of 23, and I continue to do that. That was a really big issue for me, and it was a big problem with infections, constantly in and out of hospital all the time, until I came across the leading urologist here in Australia, and one of the world's leading urologists, Dr. William Lynch. And I went and saw him, and he I had all these urodynamic studies done to see what sort of retention I had in my bladder, and I was retaining up to 1,000 mils. I would think that I was emptying, but obviously I wasn't. I'd be sitting on the toilet trying to press my stomach to empty my bladder because I had no muscle sensation to be able to empty it on my own. So what he ended up doing with me, so catheterization helped, but I was constantly going backwards and forwards, but it was like sticking a knife inside of my bladder with the catheter. It was so sensitive, it was so raw all the time. It wasn't something I was looking forward to, I can assure you. But it did limit the infections, but I was on antibiotics and have been all of my life up until 4 months ago. But what he started doing was he started doing a procedure through day surgery, and it's a procedure where I have Botox injected in multiple areas throughout the whole bladder. So I go under general anaesthetic. He dilates the bladder. Every 3 months I have this done, 4 times a year for the last 25 years. And I have multiple Botox injections, which relaxes the muscles. So that pain of inserting the catheter just disappears. But within 2 days to a week of when that effectiveness runs out, that excruciating pain comes back of like sticking a knife inside of your bladder again. It's horrific. So that's been going on up until when I started taking Emulin, which was back in March last year of 2017. So I started taking that, and I was on 14 different medications, which were horrific medications, from OxyContin to Neurontin to Seroquel, antibiotics, Panadol, Panadol, Endone, sleeping tablets, antidepressant tablets, anxiety tablets. It was just a list that just went on. And my prognosis at that point in time was that I was going to be in a wheelchair, and I developed a neuropathy problem plus a few other things. It wasn't a good scenario. But what Emulin started to do was to break down the symptoms of inflammation for me. So internally, every time that I presented to these doctors, the same urologist and the same anaesthetist has been treating me for 25 years. Inside of my bladder wall would be a multitude of ulcerated ulcers that were bleeding, pussy, every single time I went in every 3 months. And the bladder wall itself was just an angry, unhappy little camper inside of there, which hence that's where the pain factor was coming in. But the Botox would tie that pain over. Even though the ulcerated ulcers were still there, I didn't feel it because it numbed the area. That's what the Botox was doing for it. Once I started taking Emulin, I went for my first day surgery the first time, and it would have been about 4 months after I started taking Emulin. I didn't tell them anything about it. I didn't put it on my medication chart or anything, and because I just didn't even think about it. I'm still pretty sick. And they came out afterwards and saw me and just said to me, "What have you been doing differently? Because your ulcers aren't as bad. Like, there aren't as many. Like, it's still there. You've still got the same symptoms, but there's not as many." And I said, "I've just been taking this stuff," and just left it at that, because I just thought, we'll just see what happens. 3 months later, I went back, and 3 months later, my ulcers had actually all but, I think I had 2 that were left there. That's all that there was. The bladder wall itself was still an unhappy camper, but the ulcerated ulcers had diminished down to 2. And I was pretty happy. So they were telling me then, what is this that you're taking? And I then proceeded to tell them what it was. And at that stage, they said they were very interested. They were keen to know what it was. But of course, being specialists, it's that crossing that line. So I didn't push the issue. I sent them information, left them with it. Third time, 3 months later, I went back. No ulcers whatsoever. I sat afterwards and just cried. I literally cried. And this was just on Emulin still. And but the wall of the bladder was still not happy, still swollen, still red, still angry. But the ulcers had disappeared. So after each of these procedures for the previous 23 years leading up, for the next 2 days, I would just bleed profusely because it was an invasion of trauma that was occurring. So it wasn't a great experience. And sometimes I'd have to go back in a week later. It happened 5 times because it wasn't effective. On the 12-month period, so this is the 4th time that I actually had this done, and I'd started taking Klamax, and I'd only actually started 3 weeks into taking Klamax. So at that point in time, the bladder wall itself, there were still no ulcers, so they were really excited, and so was I. But the bladder wall itself had started to diminish in regards to the angriness that it had. So the colouring of this rawness that was in there had halved. So, and the swelling that was inside the bladder had reduced, which was just, they were just remarkable. Like, they were amazed by it, as I was. I was excited. I was in tears yet again. It doesn't take much to make me cry, but I was very teary about this. Anyway, 3 weeks ago to the day, I went back in, and this was my 5th time since I've started Emulin and Klamax. And I went in, and of course I'm on no medication. So for the last 3.5 months, I've been completely off all antibiotics, which has been the first time since the day I was born. Every single day of my life I've taken an antibiotic, every single day. And there's been times where I've gone in and had intravenous antibiotics because my system has become resistant to all oral antibiotics. It's been quite a journey. And this is only one part of my journey, but I'm just targeting this area because it's so powerful. But when I spoke to them afterwards, Bill, as I call him, or Dr. Lynch, but it's Bill and Rod, the anaesthetist, and then it's like Bill and Ben when I go in there, but it's Bill and Rod. And they both said to me afterwards, they came out and said, okay, now this is just phenomenal. You know, it's literally like we have given you a bladder transplant. What we've been presented with today, we thought it was good 3 months ago, but now you've got absolutely no inflammation whatsoever in the bladder wall. It just presents to us as if you've got a brand new bladder. There's not one sign of an ulcerated ulcer anywhere. There's no lesions. There's no nothing. The only thing that I have that isn't functioning is the functionality. I still don't have that control or that urge. I have the urge, but I can't make myself go to the toilet, so I still have to self-catheterize. That possibly will still have to continue, but who knows with Klamax and Emulin? Like, as you know, this has been 52 years, so from a cellular level, you know, it's a long time, so it's going to take a long time to unravel, I believe. So I still have hope in that area, but for what it's given me, and to think that I've got quantitative, measurable measures from 2 leading specialists, an anaesthetist and a urologist that can see for the past 25 years, 4 times a year, I now have a bladder that is a happy little camper. It's wrinkle-free, obviously, because I have all this Botox in there. I just wish they could transfer it somewhere else, but that hasn't happened. I've pleaded with them to try, but they won't do it. But basically, the analysis on it and the diagnosis of it is, it's nothing short of groundbreaking. And I spoke to Dr. Rajan about this on the weekend, and he just said, I am just completely blown away by this. And I said, I am myself, because my general practitioner was going to ask me to try and get off of antibiotics because I've been on them for so long. And with everything that's happening in society, with the way that our food has changed, and I'm not saying this because of Galen, but it's just fact, I don't have an immune system, so you're very susceptible to everything. So the quality in what we're getting isn't as great. So she was really concerned that the antibiotics that I was constantly taking, I had nothing to fall back on. So when I did get an infection and I had to go to intravenous antibiotics, it was serious, and I was really chronically ill. So to not be on antibiotics for 4 months now, and that was my decision. I went in and I told her that I decided to go off antibiotics because I wanted to see what would happen. And hallelujah, I'm a pretty happy person. I do take a sleeping tablet, I will say that. And I take that because I am, as Jana's famous saying is, I am sleepless with Igalen. I can't stop thinking about it, and I'm working in different time zones and my brain just will not switch off. So I do take a sleeping tablet because I need sleep. I just can't, otherwise I just don't sleep. It's been a chronic issue for me anyway. But with the excitement of what Igalen's brought into my life, I have my life stripped from my family. I've lost a lot of friends through lack of understanding, and it's not their fault. I don't hold any misgivings there. It's just, people will give you 3 months, 6 months, 12 months if you're ill, but after that period in time, they don't know what to say to you. And you really do become a recluse. You don't want to be in amongst society because it's very difficult to put yourself out there because you are so ill and you don't know what to say to people because, the first thing they're going to ask you is, how are you feeling? How are you going? And you don't want to hear that. It's not their fault, but because they're genuinely interested in you. But you want to be treated normal if you can, but there is no normal when you're dealing with a chronic illness. So to go from being an introvert for 4 years where I lived in my house prior to Igalen coming into my life because it had got that bad, or in a hospital, it was from one to the other. And I had my mother or my sons doing my shopping and my groceries and things for me because I literally did not leave the house. And to be able to come back to being my old self, which is a chatterbox, and and I'm having a bit of a laugh all the time because I literally love life. So coming from doing 20 classes a week, we owned a fitness centre. I used to be an extremely active person. I was in the ambulance. I have a pathology degree. I was a beautician. I've had a very, all based around health, but always been very much a people person. So to have 4 years of being incapacitated and to have this give me my life back, but that one section that I can honestly say today through sharing this with you today is something that I know is measurable because I've got 2 leading specialists for 25 years that have treated me, and I have proof. And it's been very remarkable to have that and to be able to share that. And what he actually did end up saying to me, and I didn't have to ask, he's wanting to organise to talk to Dr. Rajan and to Dr. Stefano, but he actually wants to start taking the product himself so he can see and then start utilising it with his patients. So that's been his decision, not mine, but it's just been through what he's witnessed and he's given it time to see what it's done. So I thank you for letting me share it. I've left it alone for that long because I really wanted to make sure that it was doing exactly what they were telling me it was. My friends have told me myself that I don't have anything injectable or anything like that put into my face or skin. I've always looked after my face. Being a beautician when I first was 18, that's what I went into, and then into the fitness industry. So I've always cared for myself. But what I have noticed, and actually Eileen said to me prior to her interview, when I was interviewing her leading up to that, which Lee did the interview and did a fabulous job. She said, I looked back at photos of you 12 months ago, and she said, you're right. She said, you look like you're about 10 years older. And I said, I did. Like, I looked back and I was just a walking corpse, literally. So to get to where I'm at now, I'm not a Claudia Schiffer or anything like that, but I certainly feel a whole lot better about myself, and I'm healthy and I'm happy. None of my diseases are cured. None of them are fixed. But what I do believe that we do have is one of the best health management systems that God has given breath to, and that's through Dr. Aarons and Dr. Stefano. And I just cannot thank them enough for their their diligence and science and technology that they've put together, because I believe I would not be here if I hadn't have had Emulin brought into my life. So that's just my little part of my story with my bladder. So thank you very much for everybody for listening.
Oh, Jackie, that was amazing. I mean, where would we be without you? If you hadn't found these products, things would be a whole lot different in the whole company, I think. And you do such a beautiful job of interviewing, and your story as the interviewee is just absolutely fabulous. It's like 2 Wonder Women on the call tonight, and I think that's all we need for tonight. I think that's absolutely phenomenal. And if we can get these 2 divided up into 2 separate and use those as recruiting tools, send these to people with your final few days of the promo. I mean, who isn't going to get excited about listening, these 2 stories and then getting a chance to buy the product at the lowest possible price? So use these recordings. How do you say anything more on top of that? They're fabulous testimonies. We're just delighted that both of you have had such amazing results. Tremendous.
I've got to stop from getting emotional. If any of you do want my full journal, because it literally is a journal, please contact me, provide your email, and I'll send it to you, because all of those other disorders that I have, the effects that Emulin have given to me, which is fibromyalgia, spinal surgery, peripheral neuropathy, arachnoiditis in my spine, depression, anxiety. There's suicide in this picture as well. There's a whole big journal of it. I'm happy to share it because I have it written down. So if you would like it and you want to utilize it, if it would help one person in one little area, I'm very eternally grateful, and I'm happy to share that. So, but I just really wanted to hone just in on what my bladder story is, because it's something that is measurable by 2 very elite specialists in their field. So the credibility doesn't come any higher. So I'm very happy. So thank you, Debbie, and I'm sorry for getting teary. It just
No, you have every right, my dear.
Yes, don't apologize.
Oh, absolutely not. No, that was fabulous, and I loved, the breakdown of just doing that one section, because you have so many areas. You could almost do 2 or 3 more testimony calls just with sections, because that's targeted. Sometimes you get too many things all in one call, and it's just overwhelming. People think, well, it couldn't possibly do all of that. So it was really nice to hear that very targeted story. And I've heard your story before, and it gets, it never gets old. The inspiration that you give, and and you're not just sitting home convalescing and getting better. You're out there doing tons more than most of us are doing with your outreach and with Australia, and just hats off to you, and to you as well, Joan. Thank you so much for your story as well. Another just a stunner that's going to affect so many people when they hear it. People are going to twig, oh, I know somebody who has that, or there was such a list of things there. It's just, I'm just excited. I just got back today. I just have to tell everybody, I had a chance to meet Brian and Gail McDonald and Bev Ellis in PEI just a few days ago. So that was very exciting. Yeah. So I'm really glad I got home to make it in time for this call. As I said earlier before we recorded, my suitcase is still over here. It isn't even unpacked yet. And but this was just amazing. So I'll let someone else have 2 cents here before we end the call. So go ahead, anyone who has any comments or thoughts, please.
Debbie, I just want to actually add my doses, because I think this is really important for people too, and I didn't add that in there. I actually take 6 Emulin a day. I split that between Emulin M and E, and but where Klamax is, and I take more when I need to. So when I travel, I'll increase that to 8 to 10, because my system needs it. I don't have an immune system. It's gradually getting stronger. But on a daily basis, I take 6 Emulin, and it's 2 Emulin E, and I take 4 M. at this point in time. Where Klamax is concerned, I've played with that a lot. And what's worked for me, I'm working on a hospital-based system. So every 6 hours in a 24-hour period, I take 2 doses of where it is just diluted into 10 mils of water, so very concentrated, just swishing it around in my mouth so that it's getting into my bloodstream and it's getting to my brain where it needs to. But outside of that, my other 2 doses, I'm taking it on a very small spoon, just straight dry, just dry Klamax. I take it out and put it straight in underneath my tongue, and I find that it is a great pain reliever. So if I'm finding that I'm having some pain, if I find that my mental stability is compromised, and when I say that I'm tired, like my right eye starts to get droopy on me, or if my energy levels are down, or emotionally if I'm not coping with things, as we all do, whatever it is, we're overtaxed, I'll take that spoon of Klamax and put it dry and underneath my tongue, and within 10 minutes, it's like somebody's given me an injection of energy, and I'm back to where I was. Like, it's just a different, and for me, that's what I've been doing with it. So every 6 hours in my 24 hours, so when I wake up to go to the bathroom in the middle of the night, I ponder out and I take my dry teaspoon of Klamax, put it in under my mouth, let it just soak away through there. So when I'm waking up in the morning, where I used to wake up and I would have a lot of pain and it would take me a long time to get moving, I don't have that anymore. So it's been really useful to do that for me personally. That's just my personal doses on how I've found that it's worked for me. So if that can be of use to somebody to try, please do. So that's all I wanted to add to it. So, yeah.
Yeah, that's very important, because it's outside the box a little bit, outside the typical dosage. I don't like that word dosage, but coming from a pharmacy background, that word pops in. But because I think it's important that people experiment. I mean, if people just did what was on the label, you'd never get the results. I mean, Brian knows that full well. And he's talked about that before, taking way more than is typical. And so, yeah, I think it's important that people, try different ways, because, you can't really go wrong with these. It's not like a medication or even some other supplements that if you take too much, there's going to be, potential issues. This is just so beautifully safe that, the sky's the limit and you've got nothing to lose. So
I think the other thing too, Debbie, to add to it, and I'll hold this little bottle up, which is just a water bottle with beautiful Klamax in it. But when I do travel as well, or again, if I'm not feeling, if I'm a bit low on energy, whatever it may be, I will put like 2 heaped teaspoons in that and just have that, and I'm just drinking on that throughout the day. So it's that constant feeding of the brain through, it's constantly stimulating those dormant stem cells to get that production happening of where it's supporting my immune system, it's supporting my energy system. So I add that within that water, and if I don't have it on those days where I'm feeling really low, but especially when I travel, that's what holds me over, and I get the other end and I'm feeling really refreshed. I get home and I'm not getting that jet lag. I don't get that type of normal experiences is what I was having, because I'm drinking this stuff all the way home instead of the bloody red wine or the white wine, which is so much nicer. But yeah. I'm sitting there having the Klamax instead, but it's better for me.
Well, the other thing about that I just experienced, this trip that we were on was a bus trip, and there were a lot of seniors, which I guess I fit into that category now. But most of them, well, chronologically I do, but there was people there that they're walking with canes, or just having trouble getting around, getting going, as you said, getting moving in the morning. And so I would take my Klamax when we'd go for breakfast in my clear water bottle from, the bottle that the bus driver gave us. I would make it in there, take it to breakfast the next morning. And it's like, what's that stuff you're drinking? Well, if that isn't a perfect segue into what it can do for you. So I've handed out a few information flyers and cards while I was on the trip too. So it definitely gets people's attention in a clear bottle. So I love that.
Yeah. So has anybody got any questions before we wrap this up, because we're heading into the hour?
I'd just like to make a comment, if I may. I'm just feeling totally overwhelmed and blessed to hear both Joan and Jackie's testimony tonight. We are so blessed to have Igalen in our lives with these two products and the difference it's making. To hear both of your stories, when you're in the industry as long as a lot of us have been, you hear a lot of stories about a lot of different products, and you know, some of it's real, some of it's maybe not so much. But this is so real and so powerful. We just need to get this videos out to everybody. And Jackie, thank you especially for really nailing it down in a powerful way as an update. I've read your story, and every time I get a little discouraged or whatever, I go back and read your long testimony in Facebook, and just to hear that update just is overwhelming to me. And soon I'm going to give you a little story about what's been happening to me right now that it's going to be a little interesting. So yeah, we're blessed to have what we have.
We are.
Great. All right. Anyone else have anything? Oh, Brian's waving. I don't know if that's goodbye or I want something to say. Oh,
Goodbye.
He's saying goodbye?
He's saying goodbye. Yeah.
Wonderful.
So, Joan,
right.
again, thank you so much just for your testimonial. Thank you, everybody that comes onto the calls. I know everybody can't always make it, so that's where it's great to be able to have them recorded and send them out, and you can utilize them. Lee, thank you so much for sharing your person's story too, because it's a very powerful one, because it's something that a lot of people do suffer with. And I just really do appreciate, as we all do, the support that you all give us. I don't think that you really realise how much energy and how much support that you do by coming onto these calls, and even little texts, little messages that we get. It really is a global family. And if anything, I felt that through the Philippines when I was there on the weekend. It doesn't matter where you go. Anybody that's involved with Igalen has just got this immense passion and immense love, that they just are so happy to meet somebody else that is involved in this phenomenal company. So I just want to thank you all. And Ron, thank you so much for your input too, because you're always very insightful with what you have.
Thank you, kids, too. I got to go. Bye.
All right. I'll let Debbie wrap it up from here.
All right. Just a fabulous call again. I just want to again remind everybody about the promo. Only a few days left. I have to jump back into where you're away for 2 weeks and then you come back and you kind of, where did I leave off? And I'm thinking, oh yeah, a few more days for the promo. I have people definitely on my list to call that are interested, and I hope everybody else does as well. So with this, I will call it. What?
Next week, isn't it the 4th of July? So we won't have a call next week.
Oh,
That's
okay.
right.
Yes, I'm just looking in my diary, and then the following week, while Jana's on the call, I need to. I'll be following you up, Jana, with Dory, because I will see if you guys were still available to do an event management call. So I'll chase you up on it. But next week, next Wednesday evening for you guys, Thursday for us here in Australia, Philippines, Singapore, we won't have a call due to the 4th of July because all of you beautiful people will be celebrating.
All right, watch for the recordings, and I think we'll call this a wrap. Thanks again, everyone, and good night.
Good night, everyone.
Thank
Thanks for the
you.
recordings.
Thanks again.
Bye.
Bye.